everybody, and welcome to Under the Microphone, the podcast where we talk about the fascinating world of science and the people who make it happen. My name is Antoinette. I'm founder of Relat and also your host for Under the Microphone. Today, we are happy to have Dr. Ashlin Rampul under the microphone with us. Dr. Ashlin Rampul started his journey in laboratory medicine and moved into the world of robotics, artificial intelligence, and digital laboratory systems. He is passionate about creating opportunities for young scientists, as well as shaping a future where technology enhances and doesn't replace human expertise. Thank you so much, Dr. Ashlin Rampul, for joining us today. Can you tell us where your journey into science started?
Before I start, I'd like to thank you, Antoinette, for inviting me to your podcast. And I'm very proud of you as a young scientist and a laboratory scientist promoting laboratory medicine and science. I've seen you at the Smelter Congress, and that's where your journey began, and it's awesome. And I wish you all the best with your podcast, and support from our side will begin at any time you need it.
Thank you very much.
You're welcome. Now, with regards to myself, Antoinette, my journey began with science, where I did a 4-year research degree, or a degree that encompasses research. And that was at the University of KwaZulu-Natal, Westville, where we worked with rats, and we tested rats which we made diabetic by a drug called streptozotocin. Now, streptozotocin is used to treat pancreatic cancers. But what it does, it destroys the pancreatic beta cells. So the pancreatic beta cells produce insulin. And without insulin, the person becomes diabetic, or an animal model like a rat becomes diabetic. And after that rat becomes diabetic, we can test the medicinal extracts in research that we used and see if it can lower the glucose by an insulin pathway. And we harvested the liver and the muscle, which the liver and muscle absorbs the most glucose in your body. So what happens is that there's a pathway where glucose becomes glucose 6-phosphate via an enzyme called hexoglucokinase. We found that these medicinal extracts worked on these rats. So that's my research model in becoming a researcher at first, and the beginning of research in laboratory medicine.
What made you decide to go into research? Did you know already from a young age that you wanted to do science? Was there something specific that inspired you?
So I really liked helping people. So the research, yes, it will help people. Remember, a lot of the research is done by medical laboratory scientists, medical technologists, but mostly scientists in the US, UK, and they have really helped people with many chronic diseases by developing drugs, So that was the first part. But I also like to help patients in terms of patient care clinically. But why my career changed from research to medicine back to research? Because chemical pathology has a lot of research in it, and it helps people in that research aspect. That's why it's a bridge between being a clinician and a clinician researcher.
So what is your research focused on? Diseases?
Mostly chronic diseases. And the most highlighted topic that we worked on when my research career is diabetes. Then after the research, 4 years of research or a research-led degree, I went into medicine, which was another 5 years. And after medicine, I did 2 years of internship and 1 year of community service, especially in a rural location where I wanted to help people. And it really made a difference being alone or not so much supervised in a hospital where people came in and needed it, especially in the rural area. So I enjoyed that part of helping people clinically. And then I led back into chemical pathology as a specialist for 4 years. And I did a lot of other research there. The ones that you've mentioned, the research on pseudohyperkalemia, diabetes, automation, digital pathology, point of care testing. So that now helps people as it's part of laboratory science research.
What did you study to get into the science or the research career track?
So chemical pathology per se is laboratory research. It's clinical plus laboratory research.
And you did your master's in that?
It's a specialist degree. So it's a specialist degree for 4 years. Like how you get a specialist surgeon or a specialist cardiologist, you get a specialist chemical pathologist or a specialist microbiologist or a specialist hematopathologist or a specialist virologist. So you get that in laboratory medicine, those types of specialists. So that I really enjoyed the 4 years. And that 4 years I was under the mentorship of Professor Pillay. It was tough, but where I am today, I must thank him, because if you ask about mentors, he was one such.
What was your favorite thing to study and to work on in medicine?
Treating diabetes, treating hypertension, treating hypocholesterolemia, engaging in things like preventative medicine, which we will chat about later. I know it's some of the questioning in my field direction. And then chemical pathology per se opened the door for laboratory medicine. And what I wanted to do is help young scientists. So therefore, I joined many societies that engage in laboratory medicine, helping young scientists, because I came from a long journey of probably 15 years around about there. And I wanted to impart that in younger scientists to be patient and also be productive in what they do and put their heads out there. So therefore, I joined societies, which we will discuss later on when you ask me about my society engagement and what I want for young scientists and other scientists for that matter.
I believe you're the first South African to be a member of the AFCC?
I was the first core member from South Africa to join the AFCC task force as a core member from Africa, particularly South Africa, to be a core member. And that's where the boom happened in promoting Africa, in promoting South African young scientists and laboratory professionals, taking them and mentoring them to the top.
You're part of the IFCC as well as the AFCC, correct? What's the difference there?
So the AFCC is the African Federation of Clinical Chemistry and Laboratory Medicine. When you talk laboratory medicine, it includes all disciplines, includes virology, hematology, every single laboratory discipline, and laboratory scientists, laboratory professionals, technologists, technicians, etc., fall under the banner. And the Africa Federation is only consisting of African countries. And that we've built. We remember Africa is still building. It's still a third world type of country situation. So we want to promote lab medicine across Africa. And to only promote lab medicine is to give the African young scientists an opportunity to attend congresses, workshops, to gain courses. So I was the first to develop and become the chairperson of that body as a young scientist. And when I became chairperson, we had webinars, seminars. We gave the young scientists from Africa opportunity to attend congresses. We had a congress 2 years ago where we raised money for them to attend that congress in Cairo, Egypt. And we had many young scientists. When the terminology young scientist, when we mean young scientist, we mean a person under the age of 40 and below. That's considered a young scientist who attended this conference in Egypt and presented. That was amazing to see the talent in Africa. Now, when it comes to the IFCC is the International Federation of Clinical Chemistry and Laboratory Medicine, which encompasses all laboratory discipline. And that's a worldwide body. And it's a worldwide body where we meet many young scientists with different cultures, backgrounds. It's amazing to meet different people. And you'll be amazed how humble and good the young scientists across the world are. We gave these an opportunity where the IFCC sponsors at least about 60 young scientists all over the world to attend congresses. So my view is developing young laboratory professionals to attain the best they can so they can shine in their discipline and have opportunities. And that I'm very proud of because I've seen young scientists really develop. Let me give you an example. There's a young scientist called Dipua Daphne Motswari. I met her in South Korea. She got in because of the bursary that was given by IFCC. And she was amazing. She's just like you, Antoinette. The first thing you see about her is she's engaging, enthusiastic, wanting to do programs. And today she has taken my role, thanks to mentorship in the IFCC core member group. I'm very proud of her and her achievements.
So does the IFCC and the IFCC that help young scientists and support them to build a bigger career? Or what is the main aim of the IFCC?
IFCC and AFCC is there to give young scientists any tools needed to brighten their career. And let me give you an example. The IFCC has many committees, many subcommittees, many webinars, seminars there. The young scientists just have to register or join a local society in this to have access to these types of things, latest research trends and whatever opportunities there are overseas. Let me give you one example of what the IFCC does. So the IFCC has an exchange program where we allow a young scientist who applies for this, they need to contact a lab. Just say, you, Antoinette, you are good in mass spec, or you like to learn something about automation, or you like to learn something about a certain tumor marker that a lab is doing in Australia or a lab is doing in Italy. What you need to do is contact that director of that lab to say you want to apply for this program. Does he have space to take you so you can learn this technique over that 6-month period? And what the AFCC does is that if you are successful, you contact that lab, the lab allows you to do it. They pay 6 months, I think 3 to 6 months for you to learn and train in that lab. They pay for your accommodation, your meals, and your flight tickets in a certain stipend in that period of time. So that's built up many laboratory professionals. I think the same candidate I spoke to you about, Dipua, spent time in a Canadian lab. So again, the opportunities are there. It's just as how the young scientists move their career, how they grab that opportunity. And the problem with laboratory professionals, Antoinette, is that laboratory professionals are very introverted because they work in a closed space and you hardly see them going outside. It's not an extrovert. People who choose this career are not really extroverted people. There's a very few percentage of extroverted people, but majority of the time they're introverted people. So for them to look for an opportunity, they rather be isolated and look over the internet instead of looking out there, joining conferences, joining meetings, joining seminars, joining webinars, etc., etc.
Yeah, that comes to my next question. What can young scientists do to get more exposure and to develop their careers? Obviously, networking is very important, knowing the right people. And so how do they get in contact, or how do they hear about these things?
I love your question because your question is a question all the young lab professionals ask about. What are my opportunities? They need to do what you did. Come to a local congress, like a smelter congress or a pathology conference, and they need to start networking basically there. You meet very different people with different knowledge bases and opportunities. You will find maybe there's a local professor there that's doing some sort of research or a assay that they are doing in their local lab, and he has funding. So by building that collaboration with that professor, it only takes you 5 minutes. Now, what I've noticed is that young scientists who come to conferences, come there, listen to a talk, eat their lunch and go home. That's not a conference. A conference is about collaboration and networking. So it starts with a conference, local conference, basic conference. Use a little bit of your money to join that conference, all right? The second thing is that you spoke about AFCC and IFCC. They need to go to the websites of those respective organizations and look at what opportunities are there. The IFCC has a website where they show you experts in a different fields of study. For example, there's an expert on POCT. Start emailing him or her and ask for what opportunities they have there, right? Number 3, the young scientists can take a certain route. It's either the academic route or the professional working job route, right? Now, the academic route is they pursue a master's and a PhD, and they look for which professor, which organization will fund them to do the master's and PhD and give them a stipend. There's organizations like the NRF, the MRC for young scientists. There's professors that have their own funding. They probably have funding built from the Bill Gates Foundation or whatever, doing research. You can pull in and join that organization or that professor. The third route is looking for opportunities. And remember, you need to be patient in looking for opportunities. You can't knock at one door and that door doesn't open and you say, I give up. You need to be knocking at 50, 60 doors. One door will definitely open for you. We have, as PathK, I'm a chemical pathologist in PathK, that we do employ laboratory scientists. They just need to be patient and look at the website. Look at those websites for the opportunities. Look at websites where they want laboratory scientists in research facilities, institutes, MRC, universities. That's what they should do. And remember, laboratory professionals, their jobs are essential service. And we've proved ourselves during the COVID that we are very, very important and must not be taken for granted. We are important in the diagnostic field, something clinicians always need.
You mentioned something as well about the congresses and people should network at these congresses. And I have to say, I've met so many people there. You measure where people come and they they eat and they go, or they bring their friends along and then they chat to each other and they sit in the corner. And you really need to network at these events. You need to talk to the people. I met so many amazing people there, and I can't wait for the next Congress to meet some more people there as well.
Exactly. And always check on the internet. It's a basic thing to look at what Congress is going to be held in South Africa. If you browse the internet and you say what congresses are in March, May, June, July, you will pick up something. For example, if you Google point of care testing congress, it'll show you that there's possibly a congress in Cape Town under CPUT. And that is important. Maybe you can join that congress, and that's where you network if you like POCT. So those are typical things. You look in the internet for those opportunities as well. But I've given you some hints of opportunities that you should start looking at as young scientists, as young laboratory professionals. And you have to be patient.
Another question that I often get from young scientists is, should they continue to get their master's? Should they get their PhD? Or should they stop at a BSc? What is the best for them in their future? Like, what is the best opportunity, or what creates the best opportunity for them for jobs?
Look, if they're looking at the academic path, then a master's and PhD is needed. Any university, any research institute, any worldwide, even look globally, because I've been to many countries globally. Once you have a PhD, a university overseas, any university will most probably employ you because you have that necessary skill. So the opportunities outside South Africa are very vast for PhD graduates. Then you get those that want to work in the industry. And for those that want to work in the industry, get your laboratory science degree or your technologist degree. And if you want to work, then you look at the opportunities of networking. And there's vendors like Abbott, Roche, Siemens, who will employ you if you have that skill. And then there's other companies that will employ you as well, like PathCare, if you have that background, or the NHLS, or wherever there's an opportunity for a young laboratory professional.
This episode has been proudly sponsored by BioSupport. BioSupport is disrupting the outlook on educational systems and translational science by turning no idea into an idea and actioning innovation and inventions for startups and educational structures. Now, back to our guest. So how did you move into robotics, AI, and automation?
That's a very good question. And again, it came with collaboration, going to a conference, meeting someone that had the same research interest as me. So there was a young scientist from Italy who was doing work on automation. So we worked both together to create this automation project that I talk about in a lot of conferences. And that was due to networking and collaboration. She had interest in it, so did I. And automation is the way to go, because if you look at it, automation, robotics is one topic on its own, because automation is a form of robotics. And remember, labs have a larger volume of patients coming in. So you want a quick turnaround time, especially for critically ill patients. And the way to do that is to automate a lab. And we've proven this with our project from Italy, where we've proved that when we automated the lab in Italy, from pre-automation, it was very expensive. People thought it would be cheaper pre-automation than post-automation. But post-automation, things were cheaper. We use little space for bigger instruments, and we combine instruments together, and we improve the turnaround time. There's lack of pre-analytical errors in the lab. Analytically, the samples were well. And remember, when you talk about automation and robotics, you have probes and arms that can even tell you if reagents are finished before they finished. So it's determination, So that's the field. And when you take AI into things, AI is the future of medicine. We can't run away from AI. I mean, everyone's using Chat GPT, Antoinette, as you know. And it's how you use AI. In the laboratory, AI is used, like, for example, we call about digital pathology. It can look at a picture and then tell you if this is a cancer. That's using digital or anatomical pathology. It can analyze data. Programs in AI can analyze data to tell you from the previous patient results, this patient could have antimicrobial resistance. It can use data to check your stock levels in your lab. It can use programming to check if the QCs are adequate and the QCs are well in your lab. So that's the way laboratory medicine is moving, Antoinette. And I think you've learned a lot from the conferences you're attending. And people are talking about AI, people are talking about automation and robotics. And it's a way, the future that the laboratory medicine personnel need to learn about.
Is it, does it still make errors? I mean, we all know robotics and AI is more accurate and it doesn't have that human error, but does it still have a little bit of error or is it completely accurate?
Okay, good question again you brought up. Okay, people think that with AI and digital pathology that there will be no humans needed. Humans need still to control that aspect and look at the data and look at the program and make sure it's functioning. There can be glitches, and that's why the human element is always needed there in the lab to check if this programming is running smoothly, to check if the automation is running smoothly. No matter what you can say, a lot of people are frightened it'll take away laboratory scientists, laboratory medicine personnel jobs, but it won't. We need to work together with it. If we look at it as an enemy, even something like POCT, it's not going to take away laboratory professionals' job because POCT is under the laboratory personnel. Just remember that.
Do you not think it might reduce opportunities? If you would normally need 50 people in a lab, now you maybe only need 2 people to run, all the machines. Doesn't that take away from young scientists and their opportunities in the field?
I don't think so at all. I don't think it'll have a major impact on jobs because the young scientists are evolving, because they will still be needing manual tests in the lab. That can't run away. So automation is therefore a term for holding that volume overload. But with regard to laboratory scientists, if they have the necessary skills and all, they will join those processes. I don't see any job problems because we've discussed the various international conferences where we spoke about POCT taking jobs, robotics, automation, artificial intelligence. I don't think so. All we need to is embrace it, but embrace it carefully and take over it instead of looking at it as an enemy.
There's another concern that's always raised when it comes to robotics and AI as well, and these digital technologies is hacking. Is that not a real fear when you fully automate as well?
It is a possibility, but that's why you have all the labs have a cyber division. So that means they need cybersecurity to be of top tier level. Remember, yes, we had a problem with the NHLS hacking. If you remember, a year ago, I don't know, sometime back, and they've lost data in that. So obviously, when you get more into future-driven needs or more into artificial intelligence, robotics, the future, in terms of using more of computer science, then you need to be computer savvy as well, having your IT team of the high level of professionals. And also, you spoke about AI digital competence. You asked me the question, our young scientists need to develop the skills. They need to learn AI. They need to learn programming. That's the future of laboratory medicine. And with the AFCC young scientists, they are having what we call courses for free. They're trying to get courses where young scientists can learn programming and AI, but specifically programming. Because with artificial intelligence, robotics, it's all computer driven.
Do you believe that science field will then move more technologically inclined? So will people have a combined digital IT along with their degree, their science degrees?
Absolutely. I think there will be a component when people revise the curriculum for laboratory scientists, for technologists, that they'll have the computer study component to it. Now, the people in pathology, in laboratory sciences now learn it by themselves, or they go to conferences and have some type of mentor or some type of guide who's working on this and say, can you teach me this? So in the future, yes, but for now, if you want to advance, you should be joining these conferences, these workshops, these courses that are offered free. That are offered free if you join AFCC Young Scientists. And I'll send you the links to you, Antoinette. You can distribute it to your network.
Please do. The other thing is also, on our first episode, we spoke to Warren Moore and we spoke a lot about, automation and the detrimental impact to the knowledge in the industry, right? So if you're getting computers and robots to do the work for you, eventually you lose that skill. So what is your perspective on that?
It's a very good question. I actually watched that podcast. I found that very interesting. That was your first podcast. And Warren's such an awesome gentleman. I love him to bits and pieces. Yes, but the issue is when you train with your basic sciences, you need to learn it. before you put computer science there. So your basic sciences need to be trained properly. And where I disagree with training is people who are writing these exams need to stay away from easy, what we call assignments using chat GPT. I think hardcore knowledge is important. Knowing your physiology of your body, knowing your anatomy, knowing processes in the lab. What is this assay? What does it do? Why this test is done? It still needs to be there. The traditional teaching followed by supplemental computer science teaching. That is important, because if we go the route where you just learn computer science and you just learn chat GPT, then you'll know nothing. You're just using a computer and Googling and adding things there. So my approach is the traditional approach. Just as how you study to be a medical doctor, you can't say I want to learn the anatomy of the heart and anatomy of the lungs from a computer screen. You have to be physically there. Similarly, with the laboratory scientists and the laboratory technologists, they need to know what they're doing, what this test does, the physiology, the anatomy, everything they learn as hardcore knowledge needs to be in the curriculum, supplemented by the computer science knowledge.
Yeah, that's my opinion as well. I believe that if an instrument is down, which is also obviously a fear with automation, if you've got a system that's down, or network issues, or power issues, then the lab stands still. So I believe it's still important to have your technologists be able to do the work manually as well, in case something like that happens. Because at the end of the day, a patient is waiting for diagnosis, and it might be critical, it might be life-threatening. So your lab can't just stop when your digital systems shut down for any reason. You have to still be able to continue.
Absolutely. If you're not trained properly, then that whole establishment is going to fall when there's things like that happening, if you don't know the manual processes. What's also interesting is, at a conference I attended in Shenzhen, they had someone called a biomedical engineer there. He's a professor. And he was explaining to me how things are evolving. In those days, they had bigger instrumentation. Now they're using smaller instrumentation and not as robust machines. But those smaller instrumentation, I can carry out multiple tests with smaller sample volumes. So there's a component also to laboratory medicine that you learn by word of mouth, but it should be there is something called biomedical engineering, a bit of it, of how a machine works and how you can fix it. Should be there. But look, there's a very few of these biomedical scientists, biomedical engineers rather, that are out there to teach these courses. But an interesting question you brought about, when things go down, you need to know the manual processes, definitely. 100.
Also, the risk, you're talking about smaller instruments that can do more samples. How is your risk then compared to, say, an instrument that can do, or a few instruments that can do a few samples versus one instrument that can do many samples? If you have an instrument down, isn't your risk higher with one instrument doing many?
Definitely. I've noticed something, in my time of my training, when we used the old, more bigger instruments, there were less downtimes with those instruments. Now, these smaller instruments using smaller volumes and probes, etc., you find large amounts of downtime with these instruments. So although, it's smaller space and larger volumes and smaller volumes to use for tests, it has its pros and cons. Everything in the world has its pros and cons. And I think with the smaller instrumentation, as you said, that's the big con with it.
And in terms of South Africa and our infrastructure, can we actually do automation? Do we have the infrastructure for that here in South Africa?
Look, the private sector, the private labs, a lot of the labs are automated already because they've pushed it in with volumes. A lot of NHLS labs are also moving to automation. So yes, we have the infrastructure. It's just that the people need to have the knowledge base and how to run automation. So it's better that they do courses or they visit labs that are automated already so they can encompass it in their labs. And that's another thing you need to do. Visit places where you have newer technologies so you can bring that to South Africa and help your patient population as a laboratory scientist,
And in terms of South Africa and the power outages, luckily we haven't had many of those recently, but how do these labs deal with that?
Right. I was speaking about labs going green in one of my talks at Smelter. You have to, you see one of our labs, N1 City in Pathcare, is gone completely solar. So you have to consider that option. Once you go completely solar, you're helping nature where you can live longer and for your future children and your grandchildren, your great-grandchildren. if you practice green lab practices. Otherwise, if you continue relying on ESCOM, then obviously at a certain stage your lab will have problems if you're relying on that electricity grid. So going green is good, and solar and all of these natural types of energies are also needed in a South African context.
And then a last segment I want to ask, which is also another big risk regarding AI and technology, is the data that gets stored in these systems. Like, who does this data belong to at the end of the day?
Look, in South Africa, we got something called the POPIA Act. It is there in place. The question is, the data, is it going to be at risk? And that data should not be accessed by anyone. So there should be regulations as we go into the future using this data and AI and whatever. We need to also protect patients' privacy as far as possible. So that data should not be used by third parties and should be kept in whoever's using that data. It should not be leaked out. So I think they should be, and that comes into IT regulations and the POPIA. But as far as I'm concerned, when it comes to pet care, our data is very, very private because it's patient data.
So you had fully automated labs at Pathcare as well. You were talking about a lab in Italy. Is that part of Pathcare?
No, the lab in Italy was another lab that we joined a research progress, a research project with. We collaborated with them, myself, as I wanted to know how can we do automation, and that's another lab. It got nothing to do with PetCare. It was my own research initiative, couple of years.
So are you planning on implementing that at Pathcare as well?
PetCare is already at N1 City is already automated to a very strong extent, and it's running well. But with regards to automation, you need to look again, as I told you, at all the parameters in terms of monetary gain, in terms of so monetary gain. I mean saving. When you automate, you need to look at robust instruments. You need to look at how much of sample volumes you receive each day before you place automation. There's a whole checklist to do before you automate the lab or use robotics in the lab.
We were talking about patient information as well. You made a very interesting point at Smarter Congress about preventative medicine as well, which is also touches on people's information and using information ethically. So maybe you can tell the viewers a little bit what is about preventative medicine, what is preventative medicine, and what that means in practice.
So remember, Antoinette, good question. Your questions are lovely. I love them. The issue here is, remember, we as laboratorians and laboratory scientists, we always diagnose disease. So we will, for example, do a HbA1c, which is a hemoglobin A1c, and it's 8. And the cutoff value, for example, is 5.9 or 6. The patient is already diabetic at that level. Or you do a cholesterol and you do a troponin, okay, let's say a troponin I, and it's high. The patient already had a heart attack. So we are diagnostic. We diagnose breast cancer with certain genetic testing, So it's too late when you diagnose, because when you diagnose, you have to undergo medical treatment or whatever surgical treatment. You already have the disease. Now, a lot of people don't talk about preventative medicine, which they should be teaching in laboratory sciences, which is what can I do before I get the disease? Let me give you a typical example, right? Let's take diabetes, for example. You do your blood sugar in the morning and you just ate a cake, let's say, and your blood sugar was 7, and you say, I'm fine, it's 7, all right? But what does that 7 mean? It means nothing. It's just a random glucose that you're doing. So we got something called an oral glucose tolerance test, where we fast you from 10 p.m. in the night, and we take a fasting glucose in the morning when you come to the lab, and then we give you glucose, a certain load of glucose, and we do a 2-hour glucose. If you have 2 abnormal values, you are diabetic. If you have one value that is totally abnormal, you can still be diabetic. But if you have one value that is borderline and another one that's borderline, one value that's abnormal but not totally, but abnormal, not totally abnormal, then we can put you in the phase of pre-diabetic. And if you're pre-diabetic, you need to have a good diet, exercise routine. We look at your family history, etc., etc. You can prevent that individual from going into full-blown diabetes. Because once that person crosses the fence from being pre-diabetic to diabetic, then their life changes completely. They're going to endure the complications of diabetes. So where can we come in? We come in with things like preventative medicine. Similarly, with your cholesterol level, if you have a high cholesterol, your family history, etc., look at it, act on it before it becomes heart disease, before it becomes atherosclerosis. Act on it. Diet, exercise. You need a drug, statin drug, to lower your LDL cholesterol? Or do you need some other drug to lower the triglycerides? You have a problem. So act before you develop the heart attack, before you develop the atherosclerosis, before you develop the stroke. Similarly with hypertension, do I have a family history? What should I do? So these are the practices. Now there's another thing with preventative medicine is the space now we're going into. And the space we're going into as young laboratory scientists should be the wellness space. See, Discovery has an app to test your wellness. How many steps you walked a day? Are you eating well? They give you discounts on healthy foods. That's a wellness.
Yeah, I never use that. I should actually start using that.
You should. It's there. It's there. It's in your medical aid or your insurance. You should use it. It's there for free once you use it.
I assume mammograms and colonoscopies, they would also fall part of preventative medicine.
Excellent. I loved what you said. At a certain age, if you have a family history risk, mammograms, important. Colorectal cancer, to go for a colonoscopy at a certain age is important. There are rules. You have a family history of colon cancer. That again is preventative medicine before it's full-blown disease and it becomes a problem to treat.
So what's the recommended ages that we start preventative medicine at? Or your recommendation?
Look, I think anyone can start preventative medicine. In your 20s, you should be doing it. I think youngsters are too used to a bad diet, lack of exercise, screen time. We're all office bound. We're all in the tech savvy zone where we can watch anything over our phone. That's why cinemas are losing out. We don't want to walk to cinema. You can watch through Netflix, but you're sitting and eating junk, and that's it. You're putting yourself at risk. So you should start at an early age and identify your family history and your risks in your own family as well. The other type of preventative medicine that I didn't discuss is this now genetics testing, where personalized medicine, it's called, or precision medicine, where people are doing a genetic test and they say, you at risk, you have this gene for diabetes, you have this gene for breast cancer, you have this gene for bad gut, for example. So then now you don't want to turn on that gene because it depends on epigenetics, etc.
Is that done with genome mapping?
Similar thing, but remember, when before a gene is turned on, it depends also on the environment. It doesn't mean in 30 years' time, you got the gene present. Just say you have the gene for diabetes, doesn't mean you're going to definitely develop diabetes. There's a risk. So what we want to tell you is that there's a risk of you developing diabetes. So act now. Because if you act in the diabetes risk, that means, okay, let's say you have that gene present and you start eating carbohydrates and sugars and cakes and you don't exercise, your risk for turning that gene on is definitely a very strong risk. That gene will be turned on. So we sing to you, if you have this gene present and it's shown in many populations, those that have this gene have diabetes eventually, then you should act now before you get diabetes or before you get some sort of other chronic disease. So that's now in the space of personalized medicine, precision medicine.
And that's where it touches on the data and what we were discussing earlier. So that data, who does that data belong to? So we spoke about the safety of patients' data, but when we do at certain companies, you can do genome mapping and all of that, but it's often it stays in the hands of the company. But who does that data belong to? I mean, you are the patient, you are going there to get this map, but a lot of companies keep that information. So in your opinion, who does that belong to?
Antoinette, it's amazing the questions you're asking. It's questions that all the people are asking, and I got an answer for you on that one. Now, this testing I spoke about to you, this wellness, personalized medicine, precision medicine, it's already gut microbiome. It's already been done in America. Now, America has made it strictly, and the policies are strictly clear, that this information should not put the patient at risk for insurance premium hikes, medical aid hikes, etc., etc. So there's regulations in place that this data will not be used for it. This data, and I agree with you, the data should belong to the patient, so the patient can decide what's good for their health with their physician or clinician that specializes in that area. The insurance companies should not use this for putting the patient at risk. So in America, that's already been cleared. It's this in South Africa needs to be cleared because companies like Discovery, Bonitas, and all should not be using that data if it's there for their own insurance hikes and insurance premium hikes and medical aid hikes. That data should be anonymized. It can be used as data, but it shouldn't be personalized to the patient that I'm not going to
Or
insure you.
exclude you from certain treatments. It should be used for the benefit to help that certain. Oh, I would actually, in my opinion, if the medical aid wanted to use that, come up with a plan, a preventative medicine plan, and then if the patient doesn't comply to the preventative medicine plan, then you can maybe put something in place like, if you don't eat healthy, or if you don't go for regular checks, then you exclude it. But if you do, follow the program properly, then you shouldn't be excluded. It shouldn't be used against you, that information. It should be used to help the patient.
Absolutely. I love the statement you made. Anything we do, we should help others. Very good statement. I think that's a good answer to that question.
Who do you believe should have access to this information and use it? You were saying that people could use it for research, but isn't there an element of consent there? If I do genetic screening and I know my information is going to be used for research purposes, I should be able to get consent, gives consent to that.
Absolutely. Number one, foremost important is that the patient has access to her result as well as her doctor or clinician that she's seeing. Now, when it comes to research, you can use the data, no doubt, but it must be anonymized. So it can be a level, you can have a cholesterol of 10, but it mustn't be an Antoinette's cholesterol, Antoinette's name that's saying 10. It can be 50 people, it must be anonymized, then you can use it for research. We've got this from patient 1, patient 2, patient 3, patient 4. There should not be any personal information given. So that type of research should be anonymized. And then secondly, if you want to use that person's result, then you need consent from that person. So just that you want to use Antoinette's breast cancer result and treatment as a case, then you need to ask permission from a patient, which is Antoinette.
And then I would like to ask you, do you have any memorable highlights in your career?
Antoinette, I have so many memorable highlights. My memorable highlights is seeing others succeed. I have colleagues that are much more brilliant in terms of their careers overseas that I've mentored, and colleagues in South Africa. I like seeing other people progress, like yourself, like the young laboratory scientists. That makes me happy. When tomorrow I get a phone call from someone that tells me, you know what, thank you, Ashlin, for that advice. Thank you, Ashlin, for that opportunity. That makes my heart happy. In terms of my own career, I was very happy to gain Healthcare Mentor of the Year for 2024, I think it is.
Congratulations.
Thank you. And 100 most influential men KZN a year ago. So those are types of things. But the mentorship thing is because of people who had faith in me. And that's why they voted for me, because I've given a lot of people that support, And, if you give someone support, Antoinette, and you see them succeed, it's really something else, And like your podcast, it's amazing to have such a thing promoting laboratory medicine. You hardly get podcasts looking at the lab and what lab scientists and laboratory professionals are doing. You are the first. I can see that it's successful, and I hope you can promote your podcast at live events like conferences and seminars, webinars, but specifically conferences, and then interview international guests, which I see in the future that's going to happen.
Thank you very much. I really appreciate that. I wanted to ask you what still excites you about your work today, but I assume that's mentorship. Do you still have the opportunity to mentor young people?
I always do that. I always like mentoring where I can involve myself with young people, and also help whoever I can. If a patient picks up the phone, I answer that call, because end of the day, everyone's equal in my eyes. But as you said, I love the mentorship. I love the teaching. I love the delivering of talks, I love all of that. And I love when I meet people and then they tell me I have this dream, and I like to see them accomplish that dream and assist if I can, if it's within my power, to make sure that they accomplish the dream.
And is there anything that you're working on currently? Any research projects that you're working on?
Look, I'm looking at that personalized medicine space and those types of testing, and I'm reading more along the lines of it and the science behind it, because I believe preventative medicine and personalized medicine is a future in terms of pathology as well. Because what I get disappointed is only having a diagnostic test and then it tells you about cancer from your histology. It's too late by that sometimes. And it's sad, to deliver that type of result where you could prevent it, So that's a sad part of being in the lab space. We're already giving you a diagnosis.
When we're talking about preventative medicine, how do you actually see that developing in South Africa? Do you want to develop that worldwide, or are you focusing on South Africa for now? And what is your view on that? What is your goal there?
I think I'm working on it in South Africa. A lot of the international countries are already following protocols on preventative medicine, personalized medicine, precision medicine. I want South African medical schools, research institutes, undergraduate curriculum to focus on those types of things, where we can prevent something. We're rather taught how to treat something. When you treat something, it's too late,
So you want that to become part of the degree and part of the teachings?
Yeah,
okay.
Part of the curriculum, yeah. And I will try my best to look at those types of spaces.
Okay, so your work is more involved with creating a space for preventative medicine, or are you actually working on that project itself?
Yeah, my work is creating a space and looking at publishing as much as I can to prove that the space is needed in South Africa. Look at the burden. Look at how many people have hypertension, diabetes, hypercholesterolemia in South Africa. It's a huge burden, which leads to kidney disease and all the other types of, that complications. Because once you go from hypertension and diabetes to kidney disease, it's too late, and there's not much dialysis centers out there in the public that can handle that. Look at cancer treatments. If you can prevent it, then you don't need to go for oncology treatment. We don't have a lot of cancer machines in the public sector. So these are if you look at certain healthcare systems, if certain countries prevent disease when they go out to the communities and they educate the communities, that's what healthcare professionals should be doing. Laboratory scientists, laboratory staff, whoever's involved in healthcare should go to the community, because that old person who's not educated and continues to eat some toxic diet or take some medicinal thing that destroys their kidney, or not take medication knowing they have high blood pressure or knowing they have diabetes, then they go into those complications, and then that's where the overload and the burden is in the healthcare system.
So is your work mainly focused on point of care testing, or is it also touching on the genome and study of the genome as well?
I wrote a recent article which I will send to you on point of care testing, the pros and cons specifically, because I think that's another space that I will explore. But I've written that article. I'll send it to you so the podcasters or the viewers of podcasts can view it and read it. But I'm focusing now on this personalized and precision medicine. That's my main focus now. So maybe in the next conference in 1 year's time or 2 years' time, you'll hear a talk from me on that. So that's my focus.
And does biome testing form part of that?
Gut microbiome, yes, I'm reading up on that as well, because there's studies that show that if you take a gut microbiome of a depressed person and you put it into that rat, the rat becomes depressed. You get a gut microbiome of a person that's healthy and happy. You implant it into and the same depressed rat, you take out that gut microbiome that caused that depression. You put that healthy gut microbiome, that happy and happy person, the rat becomes happy again and starts eating.
That is amazing.
Yeah, there's are studies like that.
So can that be a form of medicine and treatment eventually for things like depression and anxiety? Do you believe that's where the medicine is going?
That's a big space where probiotics and the gut microbiome, that's already being done in America.
What impact do you hope your work will have and leave behind?
The impact is, I like young scientists to be involved in that type of research. And the impact is that I want somebody to say, tomorrow, if I'm dead tomorrow, someone to say, I know this guy, Ashlin Rampul, was a good guy. He helped me a lot. That's the impact I'd like to have. Not something where I'm finding a Nobel Peace Prize or Nobel Prize in medicine. I'm not after those types of things, or some type of groundbreaking breakthrough where I get $100 million. I'm interested is when I go to the ground and I'm buried Someone says, yes, I know this guy and he was a good guy and he was kind to me. That's all I want to hear.
I would like to ask you if you have a final message to young scientists.
My final message to them, and it's a very important, attend your conferences, knock at doors, look at opportunities, speak to people. Education is key. Being involved in research, being involved in the newer things at conferences, newer technologies, and most importantly, be patient and be hardworking. You will get there. All of us came and we took the long road. You will get there. You just have to be patient. Knock 200, 300, 400 doors. One door will definitely open for you. I can guarantee that. Yeah.
Then you can just lastly tell our viewers where they can find you.
They can find me on, I'm a chemical pathologist at PetCare. You can see my background is PetCare. Okay. So you can see Google the website of PetCare. You'll get my email address and whatever you need. If you want any help with any initiative that you need, you are most welcome to email me. I don't ever turn people back. That's my policy. Where you can help as much as you can, you must. Yeah.
Thank you very much, Ashlin. I really appreciate that. And I hope you have a lovely day.
You too. It was a pleasure.
Thank you for tuning in to this week's episode of Under the Microphone. If you enjoyed this episode, please like and subscribe. It really helps a lot. And thank you again to our sponsors. If you'd like to learn more about them, please click on the link below. If you would like to get involved, either as a guest or a sponsor, please contact us at under.the.mic@relab.co.za and tune in again next week on Wednesday for our next episode of Under the Microphone.